Yes, so my name is Professor Philip Banfield, and I'm chair of the BMA UK Council.
This was a pre-planned visit to the island?
Yes, it was.
Just happened to coincide with where we are?
So yes, I had an invitation from the Medical Society a number of months ago, and this was the first time that we could get in the diary. They had been raising concerns and wanting to talk to the BMA for some time, completely independently of other things that were going on.
And just on that, you said about you met with doctors last night.
Yes.
There was about 60 of them, and they're raising repeated concerns about the culture on the island. Is that something that you were as aware of before the Dr Ranson case, or was that something that's come through that and then it's sort of then grown as your understanding has continued to feel?
So I knew a little bit about what was going on and what the concerns were, but what I found both alarming and distressing yesterday was the intensity of fear. Universal agreement that the doctors on the island are not engaged, or do not feel engaged with what's going on. They do not feel that they can raise concerns about safety. They feel that if they do raise concerns, they are often threatened, bullied, threatened with referral to the General Medical Council. And that kind of culture is destructive, and it is erosive of providing health in a safe manner, and that's a worry. The island should be really worried about that.
Well, just on that, do you consider then that, based on what you've said, that the island's hospital is safe? If these concerns are being raised and being ignored, that would suggest that the clinicians in charge of the hospital have serious concerns that they feel unable to raise about not only patient care but patient safety.
So, doctors will always do their best for patients in any particular circumstance, but the chance of something going wrong is much higher given the kind of culture that is apparent, still ongoing on the island, and that's really not only disappointing, it's frightening that it's still not making progress, having been raised really several years ago. And there have been lots of health boards and trusts in the UK where concerns have been raised, reports written, nothing's happened. And you have to be very careful that does not happen on the Isle of Man. And you've got to ask, really, who has been responsible for this? And who is now responsible for making this better, how to make the service as safe as it can be. It is very difficult to do without engaging the medical team, and the medical teams are feeling unengaged.
And just on that, have you seen any indication that the transition to Manx care has improved that?
I haven't seen any indication that the transition to Manx care has made a material difference to the culture of fear. There is a logic to integrating your health service. It is constrained by political jurisdiction over finances in particular. So, if Manx care was allowed to do the job that it should do, it should be an effective way of delivering care for the island. But, and here is the big but, you cannot do this with a culture of fear and bullying that would seem to be systemic in the healthcare service that you've got.
Just a couple of final things to compare. First of all, you said about this isn't just an Isle of Man issue, there's systemic failures across the UK that you're aware of. How does it compare here to what you've seen in trusts in the UK?
Well, I have to say I've seen some very dysfunctional trusts and health boards in the UK, and this is probably one of the worst cases that I've come across, which is really alarming. And that's outside of the appalling treatment of Dr Ranson, which highlights just how broken the system in the Isle of Man potentially is. And you really don't know the extent of how broken it is unless you actively seek to understand what has happened and what's going on still. I'm not sure there is a commitment there to do that. That's up to your politicians to really say, you know what, we're going to be open and transparent, and we're going to tell people what really has happened. Dr. Ranson's tribunal findings have some really disturbing outcomes listed. You know, these are matters of fact that people need to really be aware of.
I just want to finish on Dr. Ranson. Obviously, she was somebody who refused to just accept how things were, and she was somebody who, I said, her career has been largely destroyed by this, but her reputation on Ireland has been enhanced by this. She has led to seismic changes in how people view the government and sort of an opening of people's eyes to that. Just how disappointed are you that it takes one brave woman to do that and to actually reveal how broken a system was?
Well, I've met Dr. Ransom now a couple of times, and she is impressively brave in how she has stood up for what is right. And I don't think people were expecting that. There is no question that her changes to the way that healthcare was being delivered at the start of the pandemic were scientifically evidence-based. She applied her expertise to helping curtail the pandemic. She wasn't listened to. She was overruled. That is not just disturbing, that is appalling. And patients suffered from that. What she did was to stand up to try and save patient lives. And any doctor that loses their career for trying to do that needs to be applauded. And the people who are responsible for this need to hang their heads in shame.